Hi everybody, Alex Javankov here. Today I'm here in Hong Kong together with Dr. Frank Pon, who is heading our Hong Kong operations and is also responsible for Pandaomics and associated ecosystem. Though this is a competing tool, right? So what is the delta between, let's say, longevity lobster and longevity claw? And which one is better?
Wow, I would say longevity lobster is better.
Because
Yes.
his team developed it, right? I'll send it to our Frontier AI team, so they will really appreciate that feedback.
Okay.
Okay.
Yes, but I think it really depends what we need. As you just mentioned, I truly like the longevity claw as well because it can do many different tasks at the same time, and it is driven by the longevity LLM that we improved it and trained it by the Frontier team. So it is a very good tool, and most important, I think it is freely accessible, right? So it is
Yeah,
for
so
application. Yeah.
longevity claw, you can actually get it for free soon once we publish the paper.
Yeah.
If so, we have a paper and review on that.
Yeah.
If it gets published, everybody gets it for free. If not, well, sorry guys. We'll see. We like to release the tools that come with a peer-reviewed paper. So let's wait for it. So you'll be able to assess the delta between longevity claw and longevity lobster. But the idea here is, even at Insilica, which is currently the most efficient AI drug discovery company in the world, in my opinion, just by the performance metrics, 31 developmental candidates in 5 years, and 3 phase 2s, 1 phase 2A complete, planning to go phase 3. So that's kind of breakneck speed, and we also licensed a bunch of assets now to the others, kind of high quality drugs. But from Insilico perspective, even with our resources and speed, we cannot bet on too many targets. And if the target is too new, too novel, pharmaceutical companies do not trust it until phase 2 complete. Or even, when several companies complete phase 2, maybe in one or several indications, to have very high conviction to bet on a target. That is why in the spectrum where you have moderate novelty to high novelty, where we have over 1,000 targets for longevity and implicated in diseases, you don't have too many bets to make. Usually at Insilico, we can make maybe 5 to 10 bets a year on in that category, like moderate to high novelty, maybe even fewer, because we need to be commercially viable, and we are working towards potentially sustainable profitability. That's kind of my dream. Imagine like a profitable Frontier AI company and Frontier Biotech in one. That's unheard of. So far, very few people developed profitable biotech, and so far, to my knowledge, nobody is profitable on the AI side, Frontier AI side, unless you are kind of just parasitizing on Frontier models or just focusing on integration. So having this yin yang with very little kind of loss or profitability requires you to bet very often on kind of lower to moderate novelty targets in order to satisfy the pharmaceutical industry's demand, because pharmaceutical companies, of course, they will claim that they like novelty, but they need to replenish their pipelines, and they like to see moderate novelty targets, or actually very established targets with significantly differentiated chemistry or different modality for drugging those targets. So we are quite focused on that other part as well, that allows us to license out assets at scale. That's where we scale. But we also invest in high novelty targets with dual purpose, aging and disease, because that's where you can get pipeline and a product targets. So targets that can go into many, many diseases, but first you need to find one where you can outperform the standard of care and preferably get to approval as quickly as possible.